Good evening, everyone. My name is Chelsea Clark. I am the Assistant Director at Conewago, Indiana, and I'm here to present on the next webinar series for the Family Webinar Series. And this one is titled Substance Use, Differences Among Men and Women. So addiction involves craving something intensely, loss of control over use, and continued involvement with despite adverse consequences. Addiction is a complex brain disease that causes the inability to stop using a substance or engaging in a behavior, even though it is causing psychological and physical harm. Addiction can cause a person to struggle to control their behaviors, have strong cravings, difficulty with emotional responses, and the inability to abstain from using. People can become addicted to a variety of things to include alcohol, drugs, shopping, food, sex, pornography, and gambling. Nearly 23 million Americans, that's almost 1 in 10, are addicted to alcohol or some other form of drugs. More than 2/3 of people with substance use disorders abuse alcohol. The top 3 drugs causing addiction disorders are marijuana, opioids, and cocaine. So addiction is now understood to be a brain disease, whether it's alcohol, prescription pain pills, nicotine, or gambling. Overcoming addiction isn't as simple as just stopping or exercising greater control over impulses. This is what is impacted when you hear about reward systems or pathways. One of the most significant parts of the brain is the reward system, and this is developed as a way to reinforce behaviors we need to survive, such as eating. When we eat foods, the reward pathways activates a chemical called dopamine, which in turn releases a jolt of satisfaction. This encourages you to eat again in the future. When a person develops an addiction to a substance, it's because the brain has started to change. This happens because addictive substances trigger an outsized response when they reach the brain. Instead of a simple pleasurable surge of dopamine, many drugs of abuse such as opioids, cocaine, or nicotine causes dopamine to flood the reward pathways 10 times more than a natural reward. This happens because addiction develops when the pleasure circuits in the brain get overwhelmed in a way that can become chronic and sometimes even permanent. So now I want to jump into understanding what the difference is between sex and gender. And it's really important to understand these definitions. So sex refers to the characteristics of an individual as a female or a male from their biological features, so what they are born as. According to researchers, there are some basic biological differences between males and females that influence how each responds to drugs and engaging in addictive behaviors. Gender is defined as a system of social organization with a set of behavioral prescriptions that are believed to follow from biological characteristics. These perceptions of gender are socially constructed and shaped by social cultural structures and processes over time. Researchers in both the social and natural sciences have demonstrated that addictions and consequences of addiction differ by biological sex and also by gender. So the differences between males and our female brains. The brains of males and females function differently. There are 7 unique traits of females and male brains. From the 2017 brain imaging study at the Amen clinics, there was over 80 areas of the brain analyzed. In 70 of those regions, female brains showed significantly more activity than male brains. Overall, women have much busier brains than compared to men. In problem solving, women tend to harness several areas of the brain, while men rely on a more localized effort. According to the study findings, men tend to have less activity in the prefrontal cortex, and the prefrontal cortex is involved with planning, judgment, empathy, and our impulse control. This can make men more likely to take risk, which can then make them more vulnerable to head injuries that can further decrease activity in this brain area. In the Amen Clinic study, female brains showed higher activities in the limbic system or emotional system. And this is situated beneath the cortex, and this part of the brain colors our emotions and is involved with bonding, nesting, and our emotions. This may explain why women are primary caretakers of children and the elderly. With the brain's frontal lobes is an area called the anterior cingulate gyrus. This is referred to as the brain's gear shifter. It helps you shift your attention and recognize the errors. Higher activity in this area increases the tendency to get stuck on negative thoughts or negative behaviors and to see what is wrong rather than focusing on what is right. It is also one of the brain's worry centers. More activity here translates into more worries. Of course, this doesn't mean that men don't worry or see problems, but men and women tend to worry differently. Visual and coordination centers work harder in men. These areas of the brain are more active in men and may explain why men tend to be more adept at judging distances and making a beeline to where they are parked. Women's intuition is real. Other brain imaging research reveals that women have larger areas in the brain dedicated to tracking gut feelings, specifically the areas deep in the frontal lobe. The female brain is generally quicker at assessing the one's thoughts based on limited information, gut feelings, and our hunches. There are more men than women in treatment for substance use disorders. However, women are more likely to seek treatment for dependence on sedatives, such as anti-anxiety and sleep medications. In addition, although men have historically been more likely to seek treatment for heroin use, the rate of women seeking treatment has increased in recent decades. Substance use disorders may progress differently for women than men. Women often have a shorter history of using certain substances such as cocaine, opioids, marijuana, or alcohol. However, they typically enter substance use disorder treatment with more severe medical, behavioral, psychological, and social problems. This is because women show a quicker progression from first using the substance to developing dependence. Additional research has shown that men are more likely than women to use almost all types of illicit drugs and are more likely to result in emergency room visits or overdose deaths. Men use substances more frequently and in larger quantities than their female counterparts. Physically, then can typically tolerate greater doses of drugs and alcohol, and may even require more of a substance than women to feel its effect. This is due to greater water weight, lower body fat, as well as faster liver and kidney functions. Men's bodies work to process and eliminate substances more quickly than females. More often than females, men can consume more of a drug than their bodies can handle and face very adverse damaging effects as a result. Women, however, are more vulnerable to the long-term effects of drug and alcohol use, and the female body retains substances for longer periods of time than men's, and also requires less of a drug to encounter the negative effects. While men have almost twice the rate of substance dependence as women, women are just as likely to develop a substance use disorder, and women are quicker to develop a clinical addiction or substance disorder than their male counterparts. Women are more likely than men to face multiple barriers to assessing substance abuse treatment and are less likely to seek treatment. Women also tend to seek care in mental health or primary care settings rather than in a specialized treatment programs, which contributes to poorer treatment outcomes. When gender differences in treatment outcomes are reported, however, women tend to fare better than men. Women are more likely than men to encounter barriers that prevent them from seeking or following through a treatment. Women are more likely to experience economic barriers to treatment, and women are also more likely to have difficulty attending regular treatment sessions because of family responsibilities. Providing comprehensive services such as housing, transportation, education, and income support reduces post-treatment substance abuse among men and women, but greater number of women need services. Women are more likely to report feelings of shame or embarrassment because they're in treatment. Anxiety or depressive disorders, which tend to be more prevalent and severe among women, may prevent women from seeking help with their substance abuse problems. Seeking treatment for substance use disorder is a big step. However, it does not guarantee that the fight is over. You must still practice what you learn in treatment, and substance abuse starts when someone uses any drug or alcohol for recreation purposes. This means you can suffer from addiction to prescription medications, as many Americans do. Substance abuse also begins when you drink to drunkenness or use drugs for intoxication or exclusively. Of course, any abuse of prescription medication is a big red flag and a risk for addiction. You need healthy friends and relationships, not toxic ones. If you need to write down some quick excuses to avoid people and places that trigger or tempt you, do it. Someone can also memorize the excuses and use them. This is to protect oneself. Mental health and addiction often accompany one another. Anxiety, PTSD, ADHD, depression, and any other mental health condition requires professional help and support. Professionals should be utilized to help one learn coping skills in the prevention of substance use disorder. Within Firetree, but also in other treatment facilities as well, there's a variety of treatment options. Some focus on cognitive behavioral therapy, motivational interviewing, group therapy, 12-step programs, or medication-assisted treatment. Cognitive behavioral therapy helps people to develop alternative ways of thinking and behaving, which aims to reduce their psychological distress. So here we're trying to change thought processes, which will then change our behaviors. Motivational interviewing is when we use a client-centered approach for people who have mixed feelings about changing their behavior. So this is really big when we are working within groups that focus on motivation, internal or external. We have group therapy, and this is a type of psychotherapy that is generally centered around a particular topic. So there's positive thinking, motivational enhancement, substance abuse education, co-occurring, and small process group, and this can focus on a variety of topics. We have life skills, cognitive behavioral therapy, and so on and so forth. We also have the 12-step programs, and these are designed for people to help one another achieve and maintain abstinence from drugs and alcohol. So this could be Alcoholics Anonymous or Narcotics Anonymous. We also have medication-assisted treatment, and this is when we use medications in combination with counseling and behavioral strategies to provide a whole patient approach to the treatment of substance use disorder. This is when a patient may choose to use Suboxone, Sublocade, Vivitrol in addition to therapy. At Firetree specifically, we have residential treatment. So this is our inpatient treatment providers where individuals live 24/7 in order to complete their treatment. We have halfway houses. That's the next step after inpatient. This is where individuals can start to reintegrate back into society by going to school, getting a job. They're slowly gaining that freedom and their control back. We have outpatient treatment providers, and we have residential reentry programs. And one of the biggest components of these webinars is family support as an intervention. When family members are involved or when we have that positive support system, it really does make a difference in someone's life. So family members are often so concerned about their loved one's drug or alcohol use, but they often don't know how to start that conversation or even where to begin. For many people struggling with addiction, they're often motivated to seek treatment by the care and concern of their loved ones. So it's important for family members to push through any discomfort they may have about starting that conversation and just start it. But it's really important to continue to be supportive and non-judgmental during those conversations. Be specific about the behaviors you're observing or what you've been seeing, and be prepared to offer help. Substance abuse does affect everyone in the family, so it's important that family members are involved in the treatment and recovery process for both adults and youth. Most patients engage in treatment because of positive family involvement and intervention. And each family member is affected by the chemically dependent person as they go through the process of their addiction and work on their recovery. Each family reacts with a survival behavior, and that is because behaviors cause the least amount of personal stress. But just keep in mind that relapses occur and they are part of recovery. Don't lose faith in your loved one just because they use again. Support them, understand them, and give them the guidance and direction that they may need. You cannot stop anyone from using any more than you can force them to start using. Accept that, be there for them. That's all you can do, is be that positive support for them. Your responsibility to yourself, though, does take priority. You cannot help anyone if you're unable to care for yourself. You have to put yourself first no matter what, even if that does mean taking a step back for a moment and then helping your loved one. But one of the hardest and most important parts is just starting that conversation with your loved one. By no means do you have to be an expert in the field to express your concerns. And you don't have to have the answers. Work with your loved one, express your concerns, and show them your willingness to listen and be there. Don't be afraid to talk about it. Reassure them that you care about them and you are there for them. But also educate yourself. The more you understand about conditions, symptoms, possible treatments, and what to expect, the better you'll be able to support your loved one. And I just want to end today with some resources that we're going to offer you. This is Firetree's website, our main phone number. We have Alcoholics Anonymous and Narcotics Anonymous information, their website, and SAMHSA's National Hotline Helpline. I want to thank you for joining tonight, and I hope to see you at the next webinar. Thank you.